morning and welcome. It is Tuesday, the 13th day of May. We are brought to you by Landscapers Corner, 1305 Old Frankfort Pike. Landscapers Corner has Triple Crown Elite Grass Seed. The seed everybody is talking about, available in 5, 25, and 50-pound bags. Call 225-9433. Dr. Kevin Kavanagh is with us. Good morning, Dr. Kavanagh.
Oh, good morning, sir.
Dr. Kavanagh is a retired ENT from Somerset, Kentucky, also founder and one of the honchos with an organization called Health Watch USA. What is that?
Well, it's a 501c3 nonprofit organization whose main mission is transparency and value purchasing. In other words, making sure that you get the best health care at the most affordable price. And in this, we have been very concerned about, as you well know, infections and infection disease and healthcare-associated infections, to make sure that if you get into a facility and being treated for something, that you don't come down with something you didn't come in with.
Sure.
It's an infectious disease. And so that's been one of the main impetuses of our policy, and it's been something we've been making steady progress with in the state of Kentucky.
I was going to say, you're getting the attention of a lot of folks.
Yeah, there's a proposed regulation which the governor has, which is going to address some of these virtually untreatable infections and get the state to get good data and engagement of the health department, which I think will go a long ways in their prevention.
We have a big-time guest this morning. We had the good fortune of having him on once before, and the timing is perfect for his reappearance on the program. Tell us about our guest.
Yeah, our guest is Dr. Arjun Srinivasan. He's the Associate Director of Healthcare Associated Infection Prevention Programs for the Division of Healthcare Quality Promotion in the Centers for Disease Control and Promotion, otherwise known as the CDC.
CDC. Great. Good morning, Doctor.
Good morning, Jack. How are you doing today?
I'm well, thank you so much.
Hey, Kevin, how are you?
Very well,
Appreciate you being back with us this morning. And the big news, of course, nationally, a new deadly disease traveling into the United States with unsuspecting passengers on airplanes. Health officials have confirmed a second U.S. case of MERS, or Middle East Respiratory Syndrome, this time in Orlando. A medical professional traveled to Florida from Saudi Arabia, apparently, and had to be hospitalized, and officials are still trying to track down the passengers that may have been exposed during the flights. So tell us, sir, what you know about MERS.
Well, there's not too much more to say beyond what you've just described. You know, this is a viral illness that has been present and has been circulating in the Middle East for quite some time. And, you know, public health officials, both in the Middle East and from around the world, World Health Organization, have all been involved. We don't know exactly right now all the details about how it's transmitted. We know that it is transmissible, can be spread from person to person, and we know that a fair bit of that spread has happened in hospitals while people were getting care. And so the CDC does already have recommendations for strategies that we think will be effective in containing the spread of MERS if we see cases that appear in this country, as we have now seen. And so that guidance is available on the CDC website, as is a host of other information about MERS, both for interested people and for healthcare providers. We would urge all healthcare providers and folks who work in hospitals to take a look at the guidance that we have posted on the web that tells people what they need to do if they encounter a patient who they suspect might have MERS. And that guidance that we have, the recommendations, are, of course, developed based on the best understanding that we have right now of MERS. And obviously there are a lot of folks here at CDC and at other public health agencies around the world that are working very hard to learn more about the most effective ways to prevent the spread of this disease.
We know of 2 cases in the United States. Do you know how widespread the disease is in the Middle East?
We know that it is. We know that there are a number of cases. You know, there have been reports of, I think, more than 100 cases throughout the Middle East, but I don't think we know the full extent of how widespread it is.
Do you know if there have been fatalities as a result?
There have been fatalities, and that's obviously one of the reasons why we're so concerned about MERS and so interested in making sure that we control its spread.
As a virus, antibiotics don't do anything to it, I assume.
Yeah, that's a great point. You're absolutely right, and that's, I think, an important point to emphasize because it comes up here when these types of kind of new viruses kind of do grab the headlines and grab our attention. But it's the same issue that we face every year when flu season rolls around. MERS is a virus, just like flu is a virus, just like most of the things that cause the common cold are viruses. And you're absolutely right, Jack, that the antibiotics don't work for these viruses. And so if we have a viral infection and we get antibiotics, then what we're doing is essentially exposing ourselves to potential side effects from those antibiotics for absolutely no benefit. And I think that's something that's very important for people to recognize is that antibiotics do have side effects. They can cause very bad diarrhea, including a very serious type of diarrhea called Clostridium difficile. They can also have a number of other types of side effects like rashes and things like that. And when you have an infection that needs an antibiotic, then obviously we prescribe an antibiotic and we take an antibiotic and we accept those risks because we know all medications have side effects. And if we need the medication, then we accept those the risk of those side effects because we're gaining so much benefit from the antibiotics.
Is there any kind of medication for MERS, or is it in the process of being developed?
There's nothing to treat MERS right now, and there are obviously folks who are looking at different antiviral medications, working on vaccines, but for right now, the only approach that we have to addressing MERS is to prevent its spread.
All right, let's go to the phones, and Noel's first. Good morning. Hello there. Noel? Hello? Hello there? Hello, are you there? Okay, we lost that one. 253-5959, touch star 590 from AT&T, toll free from anywhere, 1-877-777-0590. Email jackpatty@wvlkam.com. Kevin?
Yeah, I think that in Kentucky, that's been a very important point, is not overutilizing antibiotics. Unfortunately, since last year, Kentucky has now moved into the #1 position of antibiotic usage. In other words, this is a list, again, that we're the first on that we wanted to be the last on. And so it's really important that we not overutilize these things. And the other thing that I think people do not realize is that we've evolved with these bacteria for millions of years, and in some ways are dependent upon them. And it is not good to completely eliminate all the bacteria or a large portion of bacteria that our body has. We need them. For example, if you take an antibiotic, even weeks before, because you've eliminated your gut bacteria, it makes you more susceptible to getting food poisoning than someone who hasn't had an antibiotic.
We hear bacteria, we think that's a bad thing.
No, you need them to live, actually. They make vitamin K, they help digest your food. There are many things that they do that we are absolutely dependent on because we've evolved over eons with these bacteria. And so you don't want to use an antibiotic unless you're going to get benefit from it. And that's one of the things I think in Kentucky that the population has forgotten. It's more or less, well, doc, give me an antibiotic. It doesn't cost much and it might do some good. Let me take it. They don't realize that there's always could be a downside.
Let's go back to the phones again and try to get Noel back on the air. Good morning.
Good morning. I'm glad you're kind of talking about this. My wife had sinus surgery about 2 years ago, and she wasn't healing up, and it was just getting worse and worse after her surgery. And they didn't tell us, but they put her on this nebulizer for over 3 months. Well, she's really into researching and stuff, and she researched this, and what had happened is that whoever had helped in the surgery, the way we're understanding it, was not that something was not cleaned right. They wanted to say that it, and we also found out that it was something like urine on somebody's hands, that they had not cleaned their hands or something, and it was a big mess. My wife really went through a hard time with this, and it was It was the second sinus surgery she had and went through the first one beautifully, and this one was really bad.
Doctor, what's your response?
I think that you're pointing out something that's incredibly important. The need to have clean hands when we deliver health care is obviously of utmost importance, and it's perhaps the thing that we emphasize above all others. It is hand washing, I think we've known for more than 100 years, is perhaps the simplest and cheapest and most effective thing that we can do to take care of people safely. We need to do it every time before we make contact with a patient and then after we're through caring for a patient. And unfortunately, we know that we don't always do the best job of this. And this is something that is a big challenge in hospitals. And it's something I think where we really have to take the mentality of a partnership. I think patients can play an important role in helping their doctors and nurses and clinicians, anyone who comes into contact, just reminding them, hey, did you remember to wash your hands when you came in? I think we need to view it as a partnership. And clinicians and all of us as healthcare providers need to be very open and receptive to patients who ask us if we've washed our hands. We can't get defensive. We can't get hostile when people ask us that. We need to have a culture where we're all in it together and we're all working together to take the best care of everyone that we
Noel, one more comment.
Yes, sir. I wanted to say, over the last 30 years, we do a lot of work around hospitals and stuff, and I just noticed that they don't use Clorox anymore. To me, that's just smelling Clorox makes me know that things are clean.
And there's some of these things that can only be eradicated with bleach, right?
Spore formers, not only, but bleach is a very,
It's
very
helpful,
good agent.
yeah.
Well, listen, thank you so much. I appreciate it.
Thank you, Noel. We appreciate your call. And we are back with our monthly guest, Dr. Kevin Kavanagh, and we have a very special guest with us this morning, Dr. Arjun Srinivasan, and he is Associate Director for Healthcare-Associated Infection Prevention Programs in the Division of Healthcare Quality Promotion at the Centers for Disease Control and Prevention. And let's go back to the phones. This is Lee. Thanks for holding, Lee.
Yes, I have a question about MERS.
Yeah.
Since there's been more cases, obviously, in the Middle East, has there been any epidemiological studies that point to any specific demographic of people where it started, could it be in blue-collar workers? Is it just spread amongst all the social classes, farmers, city people?
This is Arjun. Yeah, I'm afraid I don't have that information for you. I don't know what all has been done. I know that a lot of epidemiologic investigations have been done and are being done, but I'm not aware of the answer to that particular question.
Okay.
Thanks, Lee. This bug is, I guess if we look at history, once it's here, is the cat out of the bag, or do you think this can be contained?
Well, I think that our experience with SARS teaches us that we can do a good job of controlling these types of infections when they occur. In particular, we can do an excellent job of controlling the spread of these organisms, of these viruses, and also bacteria in our healthcare settings. And I think that is a really, really important message to emphasize. We're not helpless when it comes to preventing the spread, not just of things like MERS, but also of these highly antibiotic-resistant bacteria like the one that Kevin is talking about, this CRE, which is a very, very resistant bacteria, very resistant to antibiotics, that has the ability to spread in our hospitals and other healthcare settings. There's a lot we can do, and we've talked about some of them already, cleaning our hands properly, following recommendations to wear gowns and gloves, to do a good job of identifying these patients when they come into our healthcare facilities to do testing. And so there's a lot that we can do to prevent the spread, not just of things like flu and other more unusual things like MERS, but also these other bacterial infections like CRE, like MRSA. And I think we've shown that we can make dramatic progress. MRSA is a great example of this. We've done a really good job. We're doing a good job of controlling the spread of MRSA within our hospitals and other healthcare settings.
How confusing is this going to be? MRSA and MRSA, people are going to think it's the same thing.
I'm sorry?
I said, this is going to be confusing. MRSA
yeah, let's be clear on that.
Yeah.
So MERS, MERS, is, completely different, very, very different from MRSA. Want to make sure that we don't have any confusion on that front.
Okay, we're taking a break for an update from the Information Center. We'll be right back. We have the A-team with us this morning. Dr. Kevin Kavanagh is in the studio. Dr. Arjun Srinivasan is on the phone. He's Assistant Director for Healthcare-Associated Infection Prevention Programs with the CDC. Kevin?
Yeah, and I think one of the things I'd like to add, and maybe tout the governor a little bit, he did an excellent job, and that's the new initiative which they're planning on implementing, is really looking at this as a system-wide problem. We say a lot about hospital this, hospital that, but in reality in Kentucky, hospitals are less than 20% of the healthcare facilities in the state. A lot of this can go on in nursing homes, go on in surgery centers, dialysis centers, and any one facility within a referral network that isn't doing well, that is having a high rate of these infections, can contaminate all others. So it's not totally within the control of any one facility.
Can't just blame the hospitals.
Right.
Yeah.
You have to look at it as a system-wide approach, and this new regulation is a system-wide approach. It's, I think, one of the few regulations that is incorporating all facilities. It says healthcare facilities, and that's how Kentucky's looking at it. It doesn't do everything, but at a time when budgets are being cut, programs are being cut, to really have an area that the governor is expanding, it really says a lot to the importance of this problem and how he's dealing with it. So I think it is excellent what is currently going on with the health department.
Dr. Arjun, tell us what we can expect in the next few weeks regarding. I hate to keep pounding on this MERS, but I think this is going to be information is going to be in the news now for weeks to come. Do you at the CDC issue specific regulations to healthcare providers as to exactly what they need to be doing?
We issue recommendations, absolutely. And as I mentioned at the top of the show, those recommendations are ones that we actually began thinking about and working on when the first cases actually appeared in the Middle East, before we ever had cases in this country.
When was that, by the way?
That has been, many, many months now. I can't remember the exact date, but it's been present there for quite some time. And so these are recommendations that we always believe in being prepared here at CDC. And so we began working on those as soon as these cases became apparent and were described. We've read the information that's available on effective strategies to prevent the spread, and so developed those recommendations. They are, like I said, up on the web, and I would urge all healthcare providers to take a look and be prepared, be ready, know what's there, know what's recommended, and to revisit that page from time to time. Because as you're pointing out, when you're dealing with something that can change and might change quickly, it's important to always be up to date on what's going on. And the CDC website, cdc.gov, is a great place to get the very latest information, because we pass that along as soon as we have it.
Yeah, in fact, I'm on the website right now, and it's up-to-date information, has everything on it, and in fact, if you go to the frequently asked questions section, it even has about the second case of MERS, which was 2 days ago. So it's being updated in real time, and that shows the importance of this. So it's very accurate and good information.
Something else, I want to change gears just a little bit if we could, and that is talk about AIDS. It's something that we don't hear so much about anymore. What is the world situation now regarding AIDS?
I have to say, Jack, that's a little bit outside of my area. As a physician, I do see patients at the Veterans Hospital and certainly take care of patients with HIV. But I'm not an expert on the latest issues with the demographics and the epidemiology of HIV. What I do know from taking care of patients is that it certainly has been a dramatic story of progress with respect to the number of new drugs that we have available to treat patients who have HIV. We're at a point now where lots and lots of patients can be very effectively treated with HIV medicines that they can take as infrequently as just once a day with very few side effects in many cases. So it really is a wonderful story of success with respect to treatment. Obviously, though, the key is making sure that people have access to that treatment and can get that treatment.
Yeah, and that's true. And I think that, the effort that went into AIDS needs to go into many of these other infectious diseases. I mean, a tremendous amount of money went into research and development, and it really pales, the amount of money going into the other organisms
for C. diff and those kind of things.
Yeah, just pales in comparison. I mean, there's not a whole lot of resources going into those. And one of the things I think is very important is to get Congress to fund things like the National Healthcare Safety Network, which is the reporting system, and funding research into these various organisms, and to funding new antibiotics, similar to an effort that went on with AIDS, because that money right now has not been allocated, I think, to a level that needs to be in order to address these emerging infections.
What do you think?
Yeah, and Kevin, that's an excellent point. If I can just underscore that, the president has asked for increased funds to help CDC work on this threat of antibiotic resistance. He's asked for that in his budget, and so we want to highlight that for folks and let people know that that this is absolutely important. What Kevin is emphasizing, that we need resources to do this kind of work, and the president has asked for those resources to come to CDC to really help us make strides in combating issues with antibiotic resistance.
You've been preaching this since you've been on the air with us, and probably before that, and you've been on with us, Kevin, 5 years or something like that, and you've been talking about these healthcare acquired diseases, and in this length of time since you've been on this bandwagon, have you seen improvement?
Well, you've seen improvement in some areas, and as we're improving those areas, you see new diseases popping up, and in other areas such as C. difficile, which is a severe infection that causes diarrhea, sometimes fatal. There's, I would say, only been modest improvement, and in some areas it's getting worse, and so it's still a area that is very, very difficult. And some of the diseases that are popping up, such as CRE, are becoming even more harder to treat than the ones that are becoming under control. So even though there is improvement, it's something that we really need to focus on, because the new antibiotics are not being produced. I mean, the easy ones to find have already been found, and there's not a whole lot of antibiotics that are new coming down the pipeline to counteract the bacteria, which are through their own chemical factory making enzymes to counteract the antibiotics, which we now have.
Doctor?
I agree. I think Kevin's hit it right on the mark. We are encouraged by the progress that we've seen, but it's not uniform progress across the board. There are still areas, there are types of infections where we're not making the progress that we'd like to see. And this issue of antibiotic resistance is one that is, cause for great concern. I mean, CDC has really been sounding the alarm on this problem. There is certainly a need for urgent action. We're running out of antibiotics to treat patients, and that's a scary thought, and it's something that we can do something about. And one of the things that we can do today is work hard to improve the way we use antibiotics. We know it's going to be some time before we have new antibiotics available to us, so what we need to do until that day is work hard to make sure that we use the ones that we have really, really well.
And we are back with Dr. Kevin Kavanagh in the studio. On the phone, we have Dr. Arjun Srinivasan. He is Associate Director for Healthcare Associated Infection Prevention Programs with the CDC. As we go back to the calls, and this is Charlie. Thanks for holding, Charlie.
Hey, Jack. I wanted to ask your guests, they're talking about antibiotics and the need for new things.
Right.
None of the big pharmaceutical companies are even trying to develop any, because they scrapped all those programs based on what they termed as portfolio decisions for their stockholders and themselves to make big profits. They'd rather manufacture antidepressants and shove out old antidepressants under new names so they can make billions. So I wondered if either one of your guests had a real-life answer as to how we're going to somehow, magically have new antibiotics to treat these diseases anytime in the future. And I'll hang up and listen.
Okay, thanks. That's a good
Well,
question.
that's kind of a political question. First of all, it takes about $1 billion to bring an antibiotic to market, and by the time it's there, to recoup the money, the bugs become resistant to it. I mean, that's what I guess has been happening, and the newer ones may even take more, and it's hard to raise $1 billion in the private industry or private investors when you say, hey, give us some money. No, you're not going to get a return.
Right.
I mean, that's just, that's just a real problem. And that's really where I think the role of government steps in and why that they need to get some subsidies and government help to get these things developed.
You agree with that, Doctor?
Yeah, absolutely. I think this is definitely a challenge, as people are pointing out. These are for-profit companies, and they do have to make decisions based on the direction and interests of their shareholders. And as Kevin is pointing out, this is an opportunity for public-private partnerships and an area where we have to establish those types of partnerships. The government is doing quite a bit. There is a lot of discussion about the ways that the government can contribute and can work to move this forward to help improve and speed up antibiotic discovery. This is a place where there already has been some action. There's an act that was passed not too long ago by Congress called the GAIN Act, the Generating Antibiotic and Antimicrobials Now Act, which provides some incentives to companies. So that's one approach that's being taken. There's also, more basic research work that's being funded by the government that will help try to spur new discovery of antibiotics. So, the theme that I think we've had all along is that, everybody's in this together, which means that it's going to take everybody pulling in the same direction in order to solve this problem.
We've got a question from Joyce. Says, what, if any, are the health implications of healthcare professionals wearing unsterilized jewelry while performing procedures, also wearing scrubs outside the facility, and then returning to perform procedures?
Those are issues that, we do have recommendations from the CDC on the wearing of jewelry. It can be an issue if you're wearing especially loose-fitting jewelry that might hang into and get into a field, a sterile field where it's not supposed to be. And we do have some kind of specific recommendations for healthcare workers being careful about the types of jewelry that they're wearing. Likewise, most places do have recommendations, and in many hospitals they have requirements that people not wear their scrubs back and forth and take them home. And that's just something that I think makes common sense for healthcare workers. If I'm seeing patients and I'm wearing my scrubs in the hospital, I don't want to take them home. I don't want to, take what's from the hospital back home. So it's good to change. Get those things laundered at the hospital. Don't wear them home, and then bring them back and forth. So that is something that is also recommended.
I've got an email from Patricia, and this is a good example of people being concerned. It says, I have an MRI scheduled for this Friday at Lexington Clinic. Should I be worried about MERS since I'll be in a healthcare facility?
No. There's been a couple of cases of MERS in the United States. Both of them are in patients who had traveled from other countries. This is not something, and this is certainly an issue that we want people to be aware of. People need to get their health care. And people should not be afraid to go and get health care because of what's going on with MERS. Hospitals and other healthcare facilities need to be aware of MERS and look at the CDC website, know what's going on, and know the steps that they need to be taking within their hospitals and other types of healthcare facilities. But we don't want people to avoid getting healthcare because of this.
Yeah, and I can just, have to certainly agree with that. And I'd like to also talk about a little bit about some other treatment options that are coming down the pike, and that's of using other bacteria or organisms to fight infections. And you're starting
about like probiotics?
Like probiotics. There's fecal transplants. You see that with phage therapy. And this is a whole area which needs tremendous amount of funding and research.
And Kevin, you made a good point off the air. You said if we were talking about this 5 years ago, people would think we're nuts.
Oh, yeah, they would. And fecal transplants and probiotics. When you say probiotics, what are the bacteria in the probiotics? What's the optimal type of bacteria? How effective are they? These are all questions that need funding and research.
Shirley, real quick, we're almost out of time. Very quick.
Okay, should I not travel to the Middle East, Dubai, Bahrain, whatever, because of this?
Great question. Let's get hang up and listen to the answers. Should we restrict our travel to the Middle East?
You should check the CDC website. There are recommendations for people who have travel plans to the Middle East that are there, and those are being continuously updated. So again, cdc.gov, really one-stop shopping for all of the latest information on MERS and a host of other topics, including the antibiotic resistance.
Doctor, I love having you as a guest. Thank you so much for being with us.